Hello, my name is Ryan, and this is my HCA 340 final presentation. I am speaking as a representative of the Risk Management Department within the Legal Department of Crescent Valley Hospital. Now, here's an introduction. From the standpoint of healthcare law and ethics, this case concerns Mr. Daniel Jacobs. Informed consent, medical record integrity, peer review, duty of disclosure, and liability will be the main topics of this examination. I'll also go over difficulties the hospital faces as a result of this circumstance, and I'll end with suggestions meant to lessen legal risks and enhance patient safety. The actions conducted before, to, and following the surgery provide a greater legal risk to the hospital than the harm itself, even though the surgical complications itself is significant. Now, a little bit of background for this case. Mr. Daniel Jacobs, who is a 68-year-old patient, came into Crescent Valley Hospital for acute abdominal pain. The attending surgeon, Dr. Laura Reynolds, determines that Mr. Jacob needs a laparoscopic gallbladder removal. And due to an emergency, Dr. Reynolds appoints a newly licensed nurse, Cameron Taylor, to obtain his consent. During this time, the nurse used a pre-printed consent form and failed to discuss the known risks or any alternative treatments. And during the surgery, the bile duct was severed, leading to serious complications. Afterwards, documentation was altered, the peer review was compromised, and the patient and family were not fully informed of what occurred. This brings up informed consent issues. At Crescent Valley Hospital, a serious issue arose regarding the informed consent for the surgery. In this case, it was Nurse Cameron Taylor, who was a newly licensed nurse, still on her probation period. She was asked to obtain consent for a laparoscopic gallbladder removal. However, no informed consent was truly offered. Dr. Reynolds, who was the attending surgeon, was not present to discuss the procedure, potential risks, or alternative treatments. And according to legal and ethical standards, a physician should witness the patient's signature on the consent form and ensure that the patient fully understands the risks, benefits, and alternatives. Both nurses and physicians have a legal duty to provide informed consent. This includes explaining serious risks such as potential injury to the bile duct and offering other alternative options, including non-surgical approaches. In this situation, no alternatives were offered, and the patient was not given an opportunity to make a fully informed decision. Because of this, Crescent Valley faced a violation of the standard of care. The failure to properly obtain informed consent not only puts the patient at risk, but also exposes the hospital and medical staff to legal liability. Ensuring proper informed consent is a cornerstone of patient rights and professional responsibilities, and it is crucial that physicians and nurses follow established protocols to prevent such violations in the future. Now let's talk about the surgical complications and liability. Bile duct injuries can occur even when the surgeon acts appropriately. However, when such an outcome is paired with deficient consent and questionable documentation practices, the hospital's risk increases significantly. Pogue states that the most common cause of bile duct injuries is trauma to the bile duct during a laparoscopic cholecystectomy or gallbladder surgery. It is estimated that as many as 1% of gallbladder operations may lead to injury to the bile duct with subsequent development of a bile duct stricture. And based on the lack of informed consent, this raises liability and lowers the protection of Crescent Valley Hospital. They prove negligence with damages and standard of care violations as well. One of the most significant legal concerns regarding this case would be the falsification of medical records. Dr. Reynolds told charge nurse to update the charts even though no conversation was held. Asking a nurse to document a conversation that never occurred constitutes falsification. Fraud and falsification of records leads to liability. Typically, those found guilty of document tampering or forgery may face imprisonment, fines, probationary periods, community service, or a combination of these penalties. In the peer review, Dr. Reynolds assumed everything went right with the informed consent and the alternative options. Of course, falsification of records and fraud varies from state to state, county, or local laws. And this is terrible news for Nurse Cameron Taylor, based on the fact that she was in a ethically and legally compromised position during her probation period. Another thing that rose up during this case was the peer review failures. Peer reviews are designed to improve patient safety and protect providers throughout truthful evaluations. However, those protections may be lost if the process is based or biased or superficial. The incident was reviewed by the surgical peer committee review. Dr. Reynolds was present during the meeting, but she did not speak up because she did not know that the documentations were wrong. There was no informed consent or alternatives. The committee concluded no deviation from the standard of care. Dr. Reynolds and the committee did not know that there was no prior informed consent, which may offer them protection in court. And this case proved respondent superior on Nurse Cameron Taylor based on the fact that she is an employee of the hospital. Another issue would be the failure to disclose. The patient and his family were told by the hospital and Dr. Reynolds that there was a surgical complication, but they were not informed that the bile duct had been completely severed. Failure to tell the whole truth may constitute fraudulent concealment, which can toll the statute of limitations. This is especially important given the fact that the legal action is being pursued just over 2 years ago, and the statutes of limitations vary state from state. Not only did they violate the patient's autonomy by not telling them the truth, it was ethically wrong. This case brings up whistleblowing. The family was called later by a nurse who expressed concerns regarding concealment. Whistleblowing consequences result from this, especially if retribution takes place. Risk is also increased by high employee turnover, since new hires may be less devoted to the company and more inclined to voice concerns to outside parties. Now let's talk about the challenges Crescent Valley Hospital has to face. First, there is severe legal exposure, not only from the surgical injury itself, but from failures in informed consent, medical record integrity, peer review, and disclosure. Next is reputational harm, particularly in the perception develops that the institution prioritizes self-protection over transparency. Public trust is difficult to restore once credibility is lost, and reputational damage can impact patient volume and relationships. This also exposes organizational culture. The hospital appears to operate within a culture that prioritizes risk avoidance and reputational protection over transparency and accountability. When staff are asked to alter records or discourage from full disclosure, it signals unethical behavior at the organizational level. This also exposes leadership failures, and it is evident when there isn't enough staff supervision for the newly licensed staff, and allowing conflicts of interest in the peer review. Dr. Reynolds was with friends, and she didn't want to make a mockery out of herself, so she didn't say anything, but she also did not know that there was an alteration with the medical records and consent. This also brings up the last point, which is compliance for the set of rules. There were gaps in the informed consent protocols, documentation controls, and adverse event reporting systems. Now we could talk about the recommendations for Crescent Valley Hospital. Crest Valley Hospital should take immediate and decisive action to address the legal and ethical failures identified in this case. First, the hospital must preserve all medical, administrative, and electronic records related to the patient's care to ensure compliance with the legal obligations and to prevent allegations of spoliation of evidence. The hospital should implement clear policy changes, making physicians solely responsible for obtaining and documenting informed consent, including direct discussion of risks, benefits, and alternatives with the patient rather than delegating this duty to nursing staff. In addition, Crescent Valley Hospital should adopt a stricter documentation process, including standardized consent checklists, real-time charting requirements, and routine audits to ensure accuracy and completeness. The hospital must enforce a zero tolerance for falsification of records with clear disciplinary consequences, as such actions severely undermine patient trust and expose significant legal liability. Finally, the hospital should adopt a transparency model. This is because they did get exposed for not telling the whole truth to the patient's family, and based on the reputational ruin of that, enforcing this policy will help them regain the trust of their old patients. Now we can talk about the conclusion. Even though Mr. Jacobs had a major surgical problem, the hospital's biggest legal and ethical dangers came from the systemic shortcomings in informed consent, documentation integrity, peer review, and disclosure rather than the treatment itself. These mistakes weakened patient confidence, jeopardized safety measures, and put Crescent Valley Hospital at risk of lawsuit, compliance issues, and reputational damages. In addition to lowering legal risk, addressing these problems early on is crucial for maintaining morale, principles, safeguarding employees, and rebuilding trust in the hospital management and culture. Sustainable risk management relies on responding to unfavorable situations with responsibility, openness, and legal, patient-centered procedure rather than on preventing every consequence. Here are my references, and thank you.